Dockies, this is Doc Jean and welcome to Dental Life. Now on this video, we are going to discuss how can you successfully close the deal with your patients. I will give you 5 simple steps that you can literally implement it in your practice. Number 1, have a video presentation. You know mga dockies, the problem with dentists is they have a misunderstanding of what actually marketing is. They think that marketing is automatically the same as advertising. Marketing has different concepts, and if you'd like to know more about it and learn how to really implement the correct and professional way of marketing your dental practice, DMD Center Dental Enhancement Skills Class do have this kind of training wherein you will have a mentor, Mr. Roche Ruiz, who is one of the Philippine experts in dental marketing, be able to guide you on how to do this properly. This is a hybrid training wherein you can do the lecture online and choose between having a one-on-one consultation with him or be a part of a group session. And right now, we are offering a special price and you can actually pay it in installments for 3 months with 0% interest. So I hope mga dockies, you will be able to join on this and really do something within your clinic in order to market it and be able to present it to your patient and close more deals. Now, let's go back to my suggestion, which is a video presentation. As you know, mga dockies, the people right now have a very short span of attention. Just on this video, it will probably only take you 3 seconds to stay unless you find what I'm talking about interesting. So, in the video presentation that you are going to make, it doesn't have to be too long. It can take around 1 to 5 minutes or even 3 minutes. And there are many things that you can do with it and present your services that you offer in your dental clinic in an exciting and entertaining manner. And you can present this video presentation in your waiting or reception area. This will result to a subliminal effect and allow the patients as well as their companions to really appreciate what are the services that your clinic offers. The second step that you can do in order to close the deal with the patient is the tell, show, do technique. This has been taught to us in college, but it hasn't been really truly enhanced on how we are going to be able to do this properly. As I've mentioned, I am also offering the Smart Management Dental Life Starter Program. And this will enable you to understand how to properly do these things and be able to deliver it successfully. Now, in the SMART, as I mentioned before, if you have watched the previous videos of what SMART is, and please do check it out. These are the skills, mindset, attitude, resources, and talent. And on the tell, show, and do technique, it is concentrated very much on the communication skills. Now, I don't know about you, mga dockies, but there are times that some dockies will teach you that you use highfalutin words or scientific terms when you talk to your patients so that they're going to be impressed on your knowledge in regards to dentistry. But I find it really not working when you apply it to your clients. Why? Because sometimes miscommunication happens. You want your patient to totally relate, imagine, and truly understand what the hell you are talking about. That is why I find that using very simple terms that your patient can understand is more effective than using scientific terms and things that we know that is used in our profession. Like for example, if we will say you have a periodontal disease, your patient needs to Google it first in order to understand what is the meaning of periodontal disease. So the simplest way or the layman's way of explaining it to them is, for example, using the term gum disease. Also, let's just say there is a carious existence on the tooth of the patient, you can simply say there is a cavity. Or, for example, in terms of veneers or let's just say crown, sometimes they cannot understand exactly what is the procedure of doing a crown or a veneer. You can use the term, for example, facings, or you can use cap. So these terms will allow the patient to fully imagine, understand what you are going to do. And the terms are very important in terms of communicating to your patient in the terms of tell, show, do technique. In terms of show, I believe most of you already know that it is very important that you have something like pictures or videos or actual examples of what you are going to do to your patient to enable them to understand what your suggestions will be, his or her conditions, and what is the planned treatment. Now, the do technique is actually something that can be seen precisely by showing them a short clip or showing them their own x-ray that will enable them to imagine what you are going to do in their mouth. This will also relieve them from having a subjective fear. The third is, please, this is the most common mistake of a lot of dentists and even salespeople, because the person will always ask you first, how much? And you have to resist yourself from mentioning the price first. Why? Because the moment that they hear the price, everything else becomes a blur. And sometimes they cannot appreciate even if you talk about the benefits of the services you are going to deliver to the patient. And that is why make sure that you talk about the benefits first before the price. The fourth one is providing them optional treatment. Of course, if the ideal treatment will cost a lot, and after mentioning the price to your patient, the tendency of the patient becomes hesitant to get that due to budget, then you must be prepared of providing them alternative or optional treatment that will meet up with their budget, or provide them a payment plan in order for them to be able to afford it. The last one, mga dokis, which is very, very important, is signing an agreement. This is the part that most of the dentists tend to skip, because what they do is that they immediately just do the treatment. You know, mga dokis, in any agreement or in any services rendered, verbal agreement is not very reliable. Sometimes the other party can totally deny what you agreed upon. So before anything else, you must have a ready-made agreement form that you can list down what are the things you and the patient agreed upon for their treatment. So, ayan mga dokis, if you find this video very informative and that you can truly apply in your practice, please don't forget to give me a thumbs up and like this video. Of course, subscribe para naman more dental professionals will be able to see this channel and learn as well of the tips that I have given, and hit that notification bell so that every time I upload a video, you will be notified. And truly mga Dockies, I will appreciate it if you find this video or other videos of Dental Life with Doc Jean helpful. Do share it with your other colleagues. Let's all together grow in practice and make a success in our dental life. And of course, I will appreciate if you will comment below so that you can add into whatever you think will also help them close the deal with their patients, or if you want to inquire on our several Dental Enhancement Skills Class on Facial Aesthetics, which is the mentor is Dr. Ivona Iger, who is very experienced and will provide you a UK certification on this field. And please don't forget to continually watch Dental Life and check out some of our videos, like for example, what are the 3 successful steps in order for you to have a profitable practice. So mga Dockies, I will truly appreciate your input and your participation in order for us to all together will be able to create, build, grow, and sustain our dental practice to have a good dental life. This is Doc Jean. Always stay safe and be healthy. Bye!